Welcome, everybody, to the She Found Motherhood podcast. Today, we are lucky enough to speak with Dr. Jasmina, who is a perinatal psychiatrist here in Victoria, BC. We are going to talk about those really important things that we can do, all of us can do, even before we reach out for help to improve our mental health and to help prevent mental health illness. These are the basics of mental health treatment, and really, all of us should be doing these. So we're really excited to chat with her right after this quick reminder.
Welcome to the She Found Health podcast. We are Doctors Sarah and Alicia. We're maternity doctors who are passionate about caring for women and young families from conception through the first few challenging years of parenthood.
We have 5 kiddos between the two of us, so we get it. We've been there. And we made it through to the other side, and now we want to support you through your journey.
We are delving deep into topics to prepare you to have the healthiest pregnancy possible, the best birth you can, and to thrive rather than just survive during the newborn and postpartum phase.
We want to remind you that the information that we share is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The information we share may not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. All right. Hey guys, we're talking with Dr. Jasmina today, and we are going to be talking a little about the first steps that you can take if you have any concerns around mood problems in pregnancy or postpartum, be that depression or anxiety. These are really basic steps that you can do on your own, but are really hard for some people to implement. So we wanted to make sure that we chatted about these steps because really they are the first things that we tell anybody to do when they have any concerns around mental health, be that depression, anxiety, just the stress of having a new baby, baby blues, whatever it is. And these are some things that you can do to help prevent those things from happening again. So let's get into it.
Thank you, Dr. Alicia, and you're absolutely right. Mental health conditions in pregnancy and postpartum are so common, and self-care is very important. Self-care is the first step, and it's something that is important not only if you have a mental health condition, but for every single person. It just can be a little bit harder to access and do if you're struggling with a mental health disorder. Now, women who are pregnant and in the postpartum period are particularly at risk because self-care can often be neglected during these times. We're so focused on the baby and providing care for the baby, meeting all of its needs, that we often put ourselves on the back burner. What self-care is, it's making positive changes in one's life that would help with symptoms of depression or anxiety or stress in general. And when we put ourselves care as one of the priorities, we're modeling appropriate behaviors and healthy behaviors for our children. So that can be sometimes the mantra that I have in my own mind, and that's helpful to me when I may have a little bit of guilt about self-care.
It's so true. I often tell, especially moms, I actually feel like, and this is a total overgeneralization, but I think dads are actually a little bit better at doing self-care, which can drive some of us crazy. But I think it's really important. You need to take care of yourself if you're going to take care of other people. And so without remembering that, it's really hard to do. But if we remember that we have to put ourselves first because so many people depend on us, then we're going to be a little bit better at it. Not perfect, but baby steps in these situations. So why don't we get into it? I think what you wanted to talk about specifically was something that we call nests, which I always find really cute because when you're pregnant, you always want to nest and you get in that nesting phase. So it's an easy one to remember. So why don't we jump into that?
You're right. Nests is something that we talk about all the time in perinatal mental health. And it's an acronym for 5 specific things that are part of self-care. The N stands for nutrition, the E for exercise, the S for sleep or rest, the T, time for self, and the last S for support. So we're going to break these down a little bit more to actually kind of become concrete about it and review what does this mean in pregnancy and postpartum. So the first N, or the first letter N, nutrition, it's so important because nutrition is the fuel that allows our body to keep going and respond to the demands of every day, including parenting a young infant. So it's important to eat regular, nutritious meals. Now, we all know that. It's just about how do we put that into practice. So I often like to tell my patients that this starts in pregnancy, and it's about preparation for what you're going to do in the postpartum when this baby comes, that you are going to be caring about 24 hours per day, 7 days a week. And when we think about preparation, we talk about a few things. So one of them is to prepare meals and freeze them in anticipation of having lack of time during especially those first few weeks in the postpartum. Then the other thing that's really important is snacks in between meals, because when you have a little baby, they have so many demands, and it can be actually difficult to eat one large meal. Instead, you may be able to eat several small meals. So I will often talk about creating some or making some muffins and freezing them, or making ready-made smoothies in Ziploc freezer bags, all the ingredients together, putting it in your freezer, and then when you're ready to have your smoothie, just getting all those contents out of the bag and pressing start, and there you go.
Yeah,
Quick
we
and
actually
easy.
did a podcast with Kristen Yarker, who's one of our local dietitians, all about exactly this, how to prepare for the postpartum kind of nutrition. And those are exactly some of the suggestions that she gave, a few others. So I'll link the podcast below as well. But those are some really great tips in terms of preparing. And another one that people can do is they can actually get their family. This is a great way for family members to help support, because they all want to help, or friends, but they don't always know how. So asking them when you're pregnant, if they're cooking a delicious meal, to cook extra and freeze it for you. That's a great tip.
The one thing that I often mention is to be specific with your family and friends. Let them know if you have any food allergies, if you have any sensitivities, if you have any preferences, and how many meals you may need, so that they know how to best support you. It's okay to ask for what you need. The other thing that I often talk about is maybe doing some research beforehand on the meals that you and your family may like, that are simple and easy to prepare, so that you have a bank of recipes that you can go to and make the food, so that it's quick and easy and available to you.
And this would be a great, I've been on, I don't know why, on Pinterest a lot this weekend, but this would be a fabulous Pinterest board to make, and then share it with who's ever asking to help support you, because then they can just see the recipes that you've already linked to the Pinterest. So it's less pressure for you to make those kind of quote unquote demands of people by being specific, but just say, oh, I'm making this Pinterest board. How about I share it with you? And those are all the meals that we would love if you're interested.
That's a wonderful idea, Dr. Alicia. And the one that I will now add to my list of recommendations.
Another great tip that we talked about earlier is checking out which grocery stores around you deliver, and you can often set up lists that you already like. So it's really easy for just like a weekly list of your essentials that you know you're going to get, whether that's eggs or milk or bread or apples, whatever it is that you know that you really like and are easy things. That's another great tip that you and I were chatting about earlier as well. And then for some people who have maybe a little bit more financial ability, those meal prep deliveries are.
The other thing is, if that is too expensive for some people, a lot of grocery stores do free pickup of groceries, which you can order online too. So that makes shopping much quicker and easier. Another thing I'd like to recommend is just compiling numbers of some takeout restaurants that you really like and having them at hand so that you have access to them when needed. Now, the other thing that's really important in terms of nutrition is making sure that you stay hydrated. You can, in the pregnancy, your blood volume increases, there's greater demands on your body, so you need to make sure that you're keeping up with your water intake, as well as in the postpartum period, especially if you're breastfeeding. So one really helpful tip is to keep a glass or a mug with you at all times so that you have a visual cue to remember to take fluids or drink fluids. My one last tip about nutrition is that if you're confused, there is help. And one easy way to access help is to dial 811 and ask to speak to a registered dietitian through HealthLink BC. They are available Monday through Friday from 9 a.m. till 5 p.m. Pacific time. So don't hesitate to get support.
Yeah, and a lot of extended benefits actually cover dietitians and nutritionists as well. So if you have some benefits and you want a little bit more of an in-depth kind of plan for you, there's some great dietitians, and I'm happy to link a few of our favorites in the show notes as well that you can access if you do have those extended benefits. And we often forget about that. Use your benefits.
That's what they're there for.
So I know you have a few questions that you like to remind women, pregnant people about to ask themselves. What are those questions?
So there are several questions, and it's more about curiosity and thinking about how you can improve self-care and nutrition. So the questions are, am I sitting down to eat 3 times a day? If I'm hungry between meals, do I take time to eat a snack? Am I keeping meal and snack preparation easy by accepting help and having ready-to-eat items on hand? Am I trying to include something from the 3 food groups at each meal? Am I drinking enough fluids throughout the day? And if the answer is no to any one of those questions, then maybe creating some manageable goals and making incremental changes to help improve your nutrition.
Yeah, those are all great pieces of advice. So I think in terms of a quick recap for nutrition, one, making sure that you're making healthy choices for the most part, staying really well hydrated, and thinking of ways, either doing yourself or having others help you, of creating a plan that eating healthy foods is easy and accessible for you, whatever that looks like for you.
Mm-hmm.
Great. So we've done N. Next is E.
Exercise. So there is a lot of research out there that supports the use of exercise to help combat multiple mental health disorders, especially depression and anxiety. Regular exercise can boost your mood and energy levels, promote a good night's sleep, help to reduce muscle tension and create feelings of relaxation, clear the mind, and increase self-confidence. It's also an opportunity to meet others through certain perinatal or postpartum, rather, exercise groups. like stroller yoga or stroller aerobics or whatever other opportunity, a walking group that there might be.
There's also really good evidence that regular exercise actually improves muscle aches and pains throughout pregnancy, gives you an easier pregnancy and an easier delivery as well. So not only is it great for the body, but it is great for the mind and the soul as well. And it's such an important piece that can be really hard in pregnancy because you're exhausted and busy and just trying to get everything done. But it's such an integral part of our health and wellness that that we often put to the bottom of the barrel.
Mm-hmm. Now, we often recommend 30 minutes of aerobic exercise 3 times per week, but that may not be a manageable goal in pregnancy and in postpartum, and that's okay. Remember that any exercise is better than no exercise. And every day is an opportunity to begin again. So don't let past challenges affect your present moment. You could just put on some runners and go for a stroll around the block with your baby.
And you can chunk that exercise up too. So it doesn't have to be, ideally, if you can get a 30 to 45-minute session at once, great. But if you can only do 10 minutes at a time, that's a wonderful place to start. And if you can do that 2 or 3 times a day, that's amazing.
Exactly. And now there are a lot of apps and YouTube channels that can help you do some exercise at home. So maybe start with walking, maybe start with one of those apps and see where it can take you. The other a great resource is, again, dialing HealthLink BC by calling 811 and speaking to an exercise and physical activity specialist that can give you guidance on any exercise and address exercise for all individuals of all ages and abilities. Again, they're available Monday to Friday, 9 a.m. to 5 p.m.
That's funny. I had no idea that there was exercise specialists on that. I knew about the dietitian. So you learn something new every day. And like we said before, when you're struggling with mental health, it can be lack of motivation is a huge piece. And so just chunk it down into baby steps. So if it's a 5-minute stroll you think you can do, or walking to the end of the block and back, that's a great start. And just start small and start increasing a little bit as you feel able to.
Remember, every little bit counts, as I've said already. And if you complete a small, manageable goal, that will give you momentum to move forward. And it's also a nice boost to your self-esteem. So why not?
I always like saying that I love checking things off. So if you're a list maker and it gives you joy to check things off, create a list of very basic, simple tasks to complete that day. Get out of bed, check. Maybe have breakfast, check. And these can be very basic tasks that can be a big challenge in people struggling with mental health. And so adding a walk to the end of the block and back, check. That could be your big task for the day. If you complete that, you are winning at life.
The other thing that you can use, with today's technology is the number of steps that you make, right? So it could be as simple as having 1,000 steps per day and then building from there.
Exactly. Great. So those are some great tips and ideas around exercise and good evidence that it actually helps mental health, but also physical health during pregnancy and the postpartum period. The next one is unfortunately, a bit of a challenge postpartum, but there's certainly some ways that we can improve it. And that is the first S in sleep/rest.
And remember, this is called sleep/rest. So it may not be possible to sleep necessarily, but you can maybe rest a little bit. So keeping that in mind. Now, sleep and rest are very important for both physical and mental health. And this, as Dr. Alicia said, it can be so challenging in the postpartum period. One of the things that I often say to my patients is sleep when the baby is sleeping. And what I mean by that is that If the baby's sleeping during the day, then you make a priority to sleep too. Because when you're rested, you can focus better and you're more efficient in the things that you want to accomplish. So forget about those household chores, forget about the laundry, and rest if that's what you need. One important thing to think about is to make a game plan before the baby comes of how you can prioritize your rest. This would include having a conversation with your partner or a support person that may be available to you in the postpartum period. So your partner may want to take the baby out for a stroll in the morning so that you can get some quiet time for sleep or rest. You may want to consider pumping if you're breastfeeding to provide some milk that your partner can give to the baby in the bottle so that you can have longer periods of stretch. Now, women often report that it's more important to get those uninterrupted hours. And there is this thing that happens at 5 uninterrupted hours that feels like magic. I remember that moment. And so that's why having your partner involved and having your partner do one of the feeds will actually help you feel more rested during the day.
And there's a couple of pieces to that. One, a lot of women are hesitant to pump and do bottles. There is no such thing as nipple confusion. That is a myth that has been out there. And so certainly we know that people who are rested and are less challenged with mental health are better parents in the grand scheme of things. So really prioritizing your parenting skills may be the way that you can convince yourself to get a chunk of sleep. And now that may not be every night. You may decide that twice a week, that's what you're going to do. And that's totally fine. But it is really important. And the other piece of the puzzle that we often don't talk about with sleep is driving. And if we're driving on lack of sleep, we're not safe. And so if you are somebody who needs to be driving your newborn or your toddler and your newborn around, you need to make sure that you're well rested enough that you can make the decisions that you need to do around that. So that's one way that we can kind of help to convince ourselves that sleep is actually important to us, because a lot of times we suffer because we are prioritizing, again, other people above our needs. And the other thing that I often suggest to new parents is, the breastfeeding person can do a feed at, say, 8 o'clock at night, go to bed, put an eye mask on, put silicone earplugs in. Their partner can watch a movie, snuggling their baby. Everybody knows the baby is safe, and then keep them quiet as long as possible and come get the breastfeeding parent when needed. And that's another way just to kind of know, because I know a lot of women who are struggling with anxiety, they even if their baby's sleeping, they can't sleep. So having somebody you know and trust actually being there with your baby will give you that peace of mind so you can actually fall asleep and get some rest and not be worried about your baby.
I love that suggestion, Dr. Alicia. And speaking about having difficulty sleeping, so if you notice that you're struggling to sleep when the baby is sleeping, please, please, please get help early. Talk to your family doctor, talk to a public health nurse, talk to your midwife, doula, or your psychiatrist, because insomnia is one of the biggest risk factors for developing a mental health disorder. Other resources that can help with baby sleep are sleep consultants or a postpartum doula. So now, the other thing I wanted to talk about is if you're thinking about any extra support in the postpartum period around sleep, it might be helpful to prepare yourself. So meaning that when you're pregnant, you may want to research some of the postpartum doulas and sleep consultants and potentially even meet with them beforehand so that you know if it's a good fit. That way you would feel comfortable accessing this support when you're in the postpartum period, if you need to.
Yeah, and I think there's a lot of educating yourself around what newborn sleep looks like, because the first 3 months, or what we call the fourth trimester, is a big change for you and your baby. Your baby is used to being inside of you, reliant on you for everything, and they still need you quite a bit in those first few months postpartum. So it's not like you can start sleep training right away, but understanding the normal physiology of newborn sleep and some things that you can start implementing to improve their sleep really can go a long way, especially after about 3 to 4 months, once they're in that phase that they're out of that kind of fourth trimester phase. So we certainly have a course called Newborn Sleep 101, and we go over the physiology and some things, but we also have a couple of YouTube videos I'll link below, basically kind of giving some basic tips and tricks and understanding of what newborn sleep really does look like, so you have a good expectation of what you're going into.
And remember, your baby will sleep eventually. This is just a phase and it shall pass. I have a few questions for pregnant and new mothers that you can ask yourself. How many hours do I sleep each night? Do I sleep when the baby is sleeping? Do I take time to rest or nap during the day? Do I ask for help so that I can rest or sleep? Do I need more information or support to help my baby sleep? Now, if you answered no, or if you're struggling in any of these areas and you don't know what to do about it, ask for help. Your doctor is a good resource for that. Some of the tips that I give is to ensure that you have a bedtime ritual. Now, that may be a bit challenging with an infant, but it can be as simple as taking 3 deep abdominal breaths when you're lying down in bed, just to help you relax and calm down after a busy day with your baby. It can also be a short shower, warm, hot shower, just to help you relax. It doesn't have to be a complex routine. The other tip is to try to go to bed at a reasonable hour each night. Next, you need to value your rest. It's so important, and you don't necessarily have to fall asleep. It's just as good, or almost as good, to have a chance to lie down and relax. And remember, if you're getting up with your baby throughout the night, you will need to rest during the day to make up for that lost sleep. And give yourself that permission to sleep and rest. Engage your support so that they can make this possible for you. And adjust your expectations of yourself. As we already said, the laundry can wait, the household chores can wait, but your rest cannot wait.
So another thing, and these actually apply to newborn sleep as well. So when we give our newborn sleep tips, a few of the things that we talk about is creating a sleep routine to prepare your baby's brain for sleep. So they start to learn that then when this routine is implemented, sleep comes after. So that's creating that routine before bed, right? The 3 breaths or the short shower. Do something every time you're going to bed so that your brain knows that it's time for sleep. Another thing we do is to prepare your room for sleep. So we need to sleep in a cool, dark space. So do newborns. So get some blackout curtains. Make sure that you're not overheated, that your room isn't too hot. And those are certainly some things that you can implement as well. And then finding a way to make it more comfortable when it is time to sleep. And so a lot of pregnant women get really uncomfortable. So those big body pillows can help. My husband always used to complain about my pillow fortress I would surround myself with. So a pillow between my knees, a pillow under my pregnant belly, all these things. And so figuring out ways that you can actually just make yourself more comfortable, because our bodies get awkward pregnant and postpartum, and they're so different from what we normally expect, and how we sleep is very different from what we expect. And then I think we've already talked about a couple of other tips as well. So exercising regularly makes a huge difference. So if you can get in that 20 or 30 minutes during the day, not right before bed, but earlier on in the day, that can make a huge difference in our sleep, as can making sure that we're not starving Marvin. And if you're breastfeeding, you're going to be hungry all the time. So have a snack a good healthy snack with some protein before you go to bed as well. And then the other thing that we often say, which I'm sure you do too, is caffeine. It lasts in our system for 10 to 12 hours. So make sure that you don't drink caffeine after kind of early afternoon at the latest. And it can also be passed along in our breast milk. So if you want your baby to sleep, neither of you should be having caffeine after kind of early afternoon for sure. But yeah. So
the other thing that's stimulating is nicotine. So knowing that can also affect your sleep quality, and just keeping that in mind. So now we are on to our next letter, T, or time for self. And this is often an area that is neglected by mothers, especially those who are struggling with mental health conditions. I often encourage women to explore and ask themselves certain questions to kind of get creative and to get ideas for this particular area of self-care. I ask women, what activities do you find relaxing or enjoyable? When did you last do these activities? How much time do you have for yourself each day or each week? Because sometimes it's possible that we don't have time during a 24-hour period for ourselves, but maybe in a week, we have a little bit of time here and there. So stepping back and looking at that global picture can relieve some of the stress that we may be feeling in the moment about not having particular time in that very day. Ask yourself, do I take short breaks for downtime throughout my day? How can I make more time for myself right now? Does that mean, do you get help from family members? Does that mean that you hire a housekeeper? Does that mean that you lower your expectations? Or all of the above? And so some of the tips of how do you create more time for yourself is reconsider your standards. This is a new phase in life, becoming a parent, and maybe before this you were able to be perfect and do everything absolutely right and check off every item on your to-do list. But you know what? That just might not be possible right now. Or even if it is, you will sacrifice other aspects of your life in order to be perfect, like your sleep and sanity. And those are definitely more important than being perfect. So adjust your standards. This, as I've said previously, is a passing stage. So what if your house is messy? It's not like your baby will remember. The next thing is use small pockets of time to create downtime in your day. So practice making use of moments when your baby is content or sleeping. You can use this time to watch a quick Netflix show, to have coffee or tea quietly and mindfully, or to flip through a magazine or call a friend. Do not take this moment to quickly do house chores. Those can wait. One last thing is ask for support and accept it from others. Again, here be specific, because it can be really hard, especially if you like things done a certain way, to let go of the control and allow others to help us. So be specific and let people know how you like things. It's okay. They will appreciate it too.
Yeah. And I was going to say, part of this asking for support from others is asking for support from your partner, because I think a lot of those, and we call it mom guilt for a very good reason. We often don't ask for the help that we need, and our partners are generally a bit better at doing that. So I have a lot of young moms coming in talking about how their partners go to their hockey practices twice a week, and how do they get these 5 hours of time all the time, or they go play golf on the weekend, or they go out for beers with their buddies, and I never get this time. But I think if you actually talk to your partner, they would be more than happy to take care of their child, to give you, their partner, an opportunity to do your own self-care, because you're a better human being and a better partner and a better parent when you do that. So I think having that conversation can be really hard, but often it's our own selves that are blocking us from making those doing those things, and it's us putting up the barriers to stop ourselves from doing it. So like you said, lower your expectations on the cleanliness of your house. Who cares if the dishes are sitting around for a day or two? They'll get done. You don't need to do them every time you have an opportunity to do them. And have a conversation with your partner, your support people, to get help around those things. I want to do this exercise class on Saturday mornings with my friends. That is a really important thing for me. How can we make that happen? And it will happen if you ask for help, for the most part.
Yeah, and I often find that partners are willing to help, and it's an opportunity for them to bond with a child one-on-one, which sometimes dads can miss and not have an opportunity to do. So in some instances, you're actually doing your partner a favor.
Way to spin it. It's true though. It's 100% true. Partners want to support, especially if the one parent is breastfeeding, right? Their partners really want to support them, and they don't know how they can do that. So having these conversations around how can we do tasks? You know what? It's really important to me that the laundry is folded. So to support me, can you fold the laundry? I don't care if the dishes are done, but I just hate a pile of laundry sitting on the couch. It drives me bonkers. So this is a way that you can support me. Or I want to go out with my friend. And the partners 100%, they're happy to feed the baby if they're able to. They're happy to take care of the baby because this is a way that they can actually spend some time with their child who they love as well, while supporting you to be a better you, right? To be a happier you, which is what they want. So I think we as mamas, again, overgeneralization, take too much on ourselves and don't recognize how important it is to get that support, and that actually helps the other people as well. They feel better about themselves if they know that they're supporting us. So now, speaking about supports, that's our second S, I think.
Yes, it is. So social supports are very important, especially in the peripartum period. When we think about our mental health, we know that healthy relationships are a huge protective factor. So it's important to foster those relationships, to seek them out, and to really be honest and open with the right people in your life. I often try to break supports down into 4 different categories. One is emotional. So that would be somebody that you can commiserate with, somebody that you can be 100% honest around, be yourself, and they won't judge you, or you won't fear that they will judge you. So your best friend, for some people, maybe that's their mom. For some people, it's their partner. And, there may be, if you're lucky, several people in your life who you feel that connected to, or there may be one. And that's okay. As long as there is one, that's the important thing. The next support is social support. So people that you feel a sense of belonging with, your group, your tribe. And that can be somebody who is also an emotional support for you, but it may not be. It could be a different person. So in the postpartum period, often baby groups are a way of finding that new social support, that new tribe, people going through the same life stage as you are. Then we think about practical support. So those are the people that can help you with day-to-day activities, responsibilities, childcare for your older child, groceries, house chores, laundry, car servicing, you name it, they can do it. And then the last part is your professional supports. And that can be a number of people, including your counselors, therapists, your doula, your midwife, public health nurse, primary care physician, obstetrician, or psychiatrist. So how I like to talk about this is to really plan ahead in pregnancy and then try to brainstorm, ideally at least 2 individuals that fit into each one of these categories and actually write them down, including their contact information. Then place that document somewhere visible and that's easily accessible. The reason you do this, it may sound silly right now as we're talking about it, but when you're sleep deprived, when you're tired, when you haven't eaten, or when you're struggling, this information may not come naturally to you. And that's why it's so good to have a visual reminder and all the information right there in front of you.
Yeah, I think that's an amazing idea. I've never actually thought about that, but it's a great idea. And what do you ever talk about to people about actually contacting those people and saying, "Hey, I, what do you think you would be interested in helping me with?" Or maybe choosing people that have certain skill sets, right? Because I know we often think about our parents, our in-laws, or whomever being our support system, but they actually don't have the skill sets that we need to support us. Like they don't actually know how to cook well, or they wouldn't be willing to come over and do laundry for us. So choosing like specific people that might actually be really interested in those things and asking them specifically beforehand.
Absolutely. And the other thing that I often recommend to patients is getting a calendar of when these people are available. Because they may be a great support person for you, but let's say that they've scheduled a summer holiday right at the time when you're due. Well, then you can't really count on them during that time. So you have to kind of brainstorm who are the other people that might be available during the time when you need them. And then when this individual that you originally thought of comes back, then maybe you can count on them. And just one more side note about that, about the support that you reminded me of. Yes, maybe your parents cannot, cook or cannot help with laundry, but maybe they're willing to support you financially so that you can hire somebody to do those things that you need. Remember to say yes to support in whatever form it comes, as long as it's helpful to you and overall leads to your wellness. Tips for getting support is, again, be direct and specific for what you need. People, maybe, if they're not able to give you what you need, may become creative or direct you towards sources that you may be able to get your needs, where you may be able to get your needs met. Persistence is important. So if one person cannot help you, maybe somebody else will. Or maybe that person will help you at a different time. Or maybe that person will help you find somebody who can help you. You never know. And just because somebody says no, it doesn't mean they don't want to help you. It might mean that they're just busy at that time or unavailable. The person that is often your primary support is your partner. So don't forget that person, because sometimes, you want to protect that person. You feel guilty because they're working and you just want to minimize any additional stress. But, saying to them, hey, can you help me with whatever chore you need? Or can you help me find somebody to support me in this specific way, is a great way to connect with your partner.
And that's a great tip, actually. I've not thought about that, but asking your, one or two of your trusted friends or partner that you actually feel very comfortable with to reach out to other people for support on your behalf if you don't feel comfortable asking other people. Because not all of us feel comfortable kind of asking that of other people. But, my best friend would totally ask a bunch of people for support for me if I needed it, right? Or my partner would be able to ask his parents or his good friend to help us in certain situations. So that's a really good thing I had not actually thought about.
Mm-hmm. And the other thing that you can share with your partner and your support people is, how will their support fit into your overall wellness plan? So maybe your partner, by folding the laundry, will decrease your stress level, which will help you sleep better at night. Right? Wonderful. Or maybe by folding the laundry, you'll have one less thing to do on your to-do list. You'll feel less stressed, and then you'll be able to be present in the moment more easily. Wonderful. So sharing that with your partner or support people is a great thing. Now, the other person that can help you in asking for support, if you don't feel able to do that on your own, is a medical professional. So reach out to your family physician, psychiatrist, public health nurse, or anybody else in your professional circle of support.
Awesome. Such good tips. Wow, we covered a lot of the basics of how to manage and fend off mental health illness. A start anyways. So let's just do a quick recap because we really did do a lot. So we talked about nests, and nests stand for N, nutrition, E, exercise, S, sleep/rest, T, time for yourself, and finally S, support system. And a big piece of this is recognizing that you are worth it. You need to take care of yourself before you can take care of others. And if you are going to ask for support, I should say when you ask for support, be very specific in your asks and let people know why you need that support. Otherwise, they won't necessarily understand why you're being so specific in your tasks. So I think those are some fabulous, fabulous suggestions that really we should all be implementing into our lives, regardless as if we suffer from mental health or if we're pregnant or postpartum. It's just good rules of life to live by.
Mm-hmm. And remember, I really want everybody to know that anyone can become depressed or anxious. It just really depends on how many stressors there are present and how much time, creativity, and ability you have to cope with those stressors. So you could be the most resilient person with a huge tool belt of skills. But if there are so many stressors on your plate, you too are at risk for anxiety and depression. So be kind to yourself. Be, compassionate and non-judgmental.
Treat
and take care
yourself
of
like you
yourself.
would your best friend.
Exactly.
Well, thank you so much for chatting today. I really appreciate it. And this is such an important topic, and I think we did a pretty great job of covering it.
I hope you enjoy it.
If you enjoyed listening, please head over to iTunes, subscribe so you don't miss any new episodes, and please leave us a review. If you found this helpful, take a screenshot and share on social to help other mamas access this information.
Check out our website at www.shefoundhealth.ca and join our community. We send out weekly emails and release new content focused on this incredible time in your lives. We'll also be sharing exclusive offers, so be sure not to miss out.